topic of my video is treatment of attention deficit hyperactivity disorder, that is commonly known as ADHD. As a teacher, I am interested in knowing about the treatment options for many students so I could help them. According to CDC, 6 to 7% of school-age children have ADHD, but some other studies have reported even higher numbers. According to IDEA, ADHD is not identified as a disability, so it comes under other health impaired. Attention deficit hyperactivity disorder, ADHD, is one of the most common childhood disorders. The symptoms of ADHD include difficulty staying focused and paying attention, difficulty controlling behavior, and hyperactivity. Scientists are not sure what causes ADHD, although many studies suggest that genes, environmental factors, and food additives are contributing factors. Like many other disorders, ADHD probably results from a combination of factors. Some other researchers have linked brain injuries, nutrition, and the social environment to ADHD. ADHD symptoms mostly appear early in life, often between ages 3 to 6. The symptoms vary from person to person, that's why the disorder is hard to diagnose. No single test can diagnose a child as having ADHD. Instead, a licensed health professional needs to run a series of tests to do the diagnosis. The conventional treatments of ADHD are medications, behavior therapies, and a combination of the two. In 1999, the National Institute of Mental Health published a multimodal treatment study of about 600 7 to 9-year-olds over 14 months. The study showed that medications accounted for the largest improvement in ADHD symptoms. The most common type of medication, called a stimulant. These stimulants actually have a calming effect on children with ADHD. Many types of stimulant medications are available. Some ADHD medications are non-stimulants. They work differently than stimulants. For many children, ADHD medications reduce hyperactivity and impulsivity and improve their attention, ability to focus, work, and learn. In some children, medications also improve physical coordination. However, what works for one child might not work for another. One child might have some side effects with the medication, while another child may not. Sometimes, many different medications or dosages must be tried before finding the right one. Any child taking medications must be monitored closely and carefully by doctors. The most common side effects are decreased appetite, sleep problems, anxiety, and irritability. Some children also complain about mild stomach aches or headaches, but most of the side effects are minor and disappear over time or if the dosage level is adjusted. There are no medications that cure ADHD. They control the symptoms for as long as they are taken. Medications can only help a child pay more attention and complete schoolwork. It is not proven that medications can help children learn or improve their academic skills. Along with medications, behavioral therapy, counseling, and practical support can help children with ADHD cope with everyday problems. Research made by the National Institute of Mental Health has shown that medication works best when treatment is regularly monitored by the prescribing doctor and the dosage is adjusted based on the child's needs. There are different types of psychotherapy that are used for ADHD. Behavioral therapies are used to help a child change his or her behavior. These therapies also teach a child how to monitor his or her own behavior. Then there are other treatment options like individual counseling, play therapy, and dietary interventions. There are also some controversial treatments for ADHD. For example, there are nutritional or herbal supplements, sensory integration training, anti-motion sickness medication, optometric visual training, EEG biofeedback, and many others. Like many other medical conditions, ADHD could be managed, not cured. There is no quick fix to treat the disorder. We need to understand that the management of ADHD is required from childhood to adulthood. It may be helpful to think of ADHD as a challenge that can be met.